Okay, so our fourth presenter is Madalen Bieter. I hope I pronounced that correctly, Madalen. And Madalen did a project with the IRC, the International Rescue Committee, and the name of her project is Welcome to America, Reproductive Health Education for Newly Resettled Refugees. And Madalen's original site mentor was Juliana Zuhl, and she was unable to join us, unfortunately, today. But thank you very much to Sanam Shamiri, who is joining us today as her site mentor. And Sanam is the client communication aide, which is part of the economic empowerment team at the IRC. So, Madalen, take it away. I think you're muted, Madalen.
There, we should be back online here. Sorry about that. So like Lee said, already fast forwarded. Great start. So my name is Madalen. I did a project with the IRC regarding reproductive health education. And this project started because before the pandemic, I was starting to get involved with volunteering for the IRC in Missoula, but unfortunately that opportunity was had to stop because of pandemic. And so finally last summer, I had the chance to jump back into working with the IRC and was able to do that in Boise, which is my hometown. I was volunteering with a case management team and really just wanted to support the efforts that, that they make to support newly arrived refugees here in Boise in the Treasure Valley. All right, so I volunteered with the case management team for about 6 weeks and then was approached by the executive director at the IRC, Julianne Donnelly Zuhl, and she brought up to me the need for reproductive health education and for that to be a reproducible and sustainable education module that they could get to all of their clients as part of their cultural orientation process. So when I initially took this project on, I thought, oh, this is going to be great. I'll just write, do my products and then we'll be fine. We'll get to translation. We'll produce the videos. It's going to be straightforward, easy. These folks have done similar projects before regarding COVID. We are ready. But I was a little naive in my thinking, and it took much more research, development, meetings with stakeholders to actually develop some valuable products for the IRC in Boise. So after all these conversations, we decided to start putting together an official reproductive health education module that could be presented to newly arrived refugees at during their cultural orientation process, which is a formal process of being a new arrival here in the US. And so we wanted to just be able to insert this education module into something that was already existing and kind of copy the same methods and strategies they had developed for disseminating COVID-19 information. And so what they had done before was create videos in the different target languages and then send those out via WhatsApp. And then that way clients could be informed of the latest happenings. So we wanted to kind of use that same strategy for at least one piece of the module. We wanted to include all adults and young adult clients in this education module with the idea that knowledge is power, that kind of knowing the expectations and knowing the rules that exist around sexual assault and violence here in the US and specifically in Idaho, giving them that knowledge can help protect themselves and their communities against any harm. And then also I wanted to involve community resources and partners to make sure that we were involving the experts and the already available resources in our community and kind of just create a more supportive network. So my deliverables were scripts that educated clients on or presented information regarding first an introduction to the module, kind of like a content warning of we're going to be discussing some sensitive materials. Another script discussing reproductive anatomy, health, contraception. Another video or script regarding menstruation education, another one regarding consent and healthy relationships, and finally, a video discussing the laws regarding rape and assault in Idaho. So after developing these scripts and having several meetings and feedback sessions, I created a presentation and presented that to Sanam and various members of the IRC team who are involved in this cultural orientation process for new arrivals. So the competencies, I just put them in a big list here. But they were addressed in almost every step of the process. The most important step, or the piece that really hit a lot of these competencies, were those feedback sessions, meetings, and getting feedback from interpreters at the IRC so that they could advise me in creating a culturally competent and culturally sensitive educational information. Yeah. So some successes and challenges for this project. Successes were that I was able to kind of bring in a lot of community partners and reach out to a lot of experts in the field, organizations like Faces of Hope in Boise, which is an organization that provides services to survivors of sexual assault, domestic violence, and people who are actually going through it. We were able to, at first this project started off with only like 2 consent and rape education, really. But we were able to realize that there was a need for discussion of reproductive health, anatomy, and menstruation, and kind of give a more full picture of more broad educational foundation to clients. Again, involving those community partners helped to get really invaluable input from stakeholders at different points of the development process. I think the most beneficial has and will continue to be, as this project continues to develop, is the cultural infusion that the interpreters have and will continue to provide to make sure that these educational materials are culturally sensitive and appropriate. And then again, this is just the beginning, kind of like the blueprint for what hopefully is a really successful program. We haven't had our first class yet, but hopefully we'll be able to have our first class kind of at the end of the summer or beginning of fall this year. Again, my main challenge was managing my expectations. I think I had a really narrow vision of what this project was going to be at the start. And as the ball started rolling, more people got involved. And I think these products became more valuable, but it also started to go outside of just myself. We actually had a meeting with CORE, which is kind of like the branch of the IRC that does all of the official orientation modules, which was great, but also a little nerve-wracking because that's not what I didn't expect that to happen when I started this project. So that was exciting, but also challenging to manage. Another challenge is making sure that we create the classroom environment that supports students successfully, or I guess clients successfully, and also developing client trust and buy-in to participate in such an education module. These people are just arriving to the US, and it's going to be hard to discuss such sensitive topics immediately without really knowing who each other is. And then also, again, it's going to be challenging to be able to present kind of one message after all these different cultural infusions happen. Being able to maintain one consistent message delivery, but also be sensitive to different cultures. And again, I just wanted to thank Julianne, Sanam for being here, Lee for your involvement, Dr. Cohen, and the various community partners that were involved to create this project. So thank you.
Great, Madalen, thank you. Does anybody have any questions for Madalen? I will say that I started working with Madalen last August. And I think, like she said, she thought this was going to be done by December, and by about November, it was apparent that this was a much bigger project. But congratulations for sticking with it, and really just making sure that the products are, like you say, culturally sensitive, and that, working with all the different stakeholders that you've worked with, you've done a great job with that.
Thank you.
Anybody, any questions? We've got a minute or two. Well, we can, I guess, say thank you then, Madalen. Great job.